Well, I was working and happily working, I might say, and one morning in September, I started to work and I had an awful pain in my back, and I said, man, I can't do this. I've got to go get this checked out. So went to Erlanger Hospital, well, this place right here, as a matter of fact, and they did some scans and stuff and said it was cancer, so you know, that was the reason for the pain and stuff, and it's like hitting you with a brick wall, you know, it just stops everything. The palliative care, when I was first told about it, I thought it was something like hospice or something. I thought it was the last straw, you know, and then we kept the appointment and went over, and I met this lady here, and she just took all the sting out of it, you know, and I've been keeping my appointments there. She gave me the right medicine. I'm able to be productive again. I can work around my home and stuff like that, and I couldn't do it until I went to palliative.
You know, what we do in serious illness care is we really take folks where they're at. You know, folks come in and they just don't know which end is up. Sometimes patients are facing terminal illnesses. Sometimes patients just have very serious illnesses with a lot of symptoms that need to be managed aggressively. So we are able to be there and kind of be that extra layer of support, to just be able to say, hold on a sec. This is where we're at. What have you heard? What would you like to hear? And this is how we can help you get through, because at the end of the day, if I can help you get through life-saving, life-prolonging treatments, then you have won. You know, so what we do is we help deal with pain and nausea and vomiting and, you know, different side effects that come along with chemotherapy, particularly with the cancer patient, so that they hopefully can get to a point of remission and sometimes cure.
Well, I've been able, I can keep my grass mowed. I put a 50-gallon water heater in. I did plumbing, electrical work. I can do anything that I could do before, you know, but if I hadn't met with her and she told me what she did and prescribed what she did, I couldn't do it because I just didn't have the strength. I couldn't hardly stand up. When I was taking radiation, they had to wheelchair me in every single trip, and I can walk now. I can go to the store and walk.
Mm-hmm. We are all a package of things that we bring to our first visit. We have had multiple experiences that have led us to this place, and some of those things you need a little helping hand. You know, you wouldn't deal with your diagnosis the same way the gentleman next door deals with his diagnosis. So we have all the tools. I always talk about filling our toolbox. We've got you a toolbox for home, and we've got a toolbox in the office. You don't need a screwdriver today? Great, we just have the hammer today. But you might need the screwdriver tomorrow, and we're going to have that for you. So it's a comprehensive group of folks. We have a board-certified medical director of palliative medicine and integrative medicine and family medicine.
And if anybody out there is dealing with this kind of problem, you know, talk to this lady. Talk to her. She'll make it go away. She'll make that sting go away and give you what you need. You know, she'll take care of you.